Good morning. How are you? I see from your notes right here that you are here for a cranial nerve exam. Is that correct? It says here in your notes right here that you are seeing things. You're not sure if you're seeing things in reality properly. Okay. Well, the test is very simple, very quick. It won't take long. Just kind of checking you out right now. How do you feel right now? Okay. It's very important. How do you feel? Well, I want to write that down. And when did you start feeling that way? And that's very interesting. So you keep thinking you're seeing things in your eyes that aren't there? Okay. Okay, so holding this pen up right now, I want you to tell me when you see it going off the screen. Okay? So, good. Okay. Good. Now look straight ahead. Tell me when you quit seeing it. Good. Okay, same thing on the other side. Look straight ahead. Tell me when you see the pen disappear. Good. Same thing again. Good. Same thing again. Good. Now, let me ask you if you would try and smell this. Do you smell it? What do you smell? Okay. Try it again. Okay. Now let's try something. Close this nostril right here, and only with the left side. See if you can smell this right here. What do you smell? Good. Okay, now on the other side, close this nostril and see if you smell this on the other side. Good. Okay, now I need you to see if you can smell this. Right there, smell it. Okay. Other nostril. See if you can smell this. Smell it? Okay, good. Okay, very good. We'll put a cap right on that. Now, looking at you, look straight at me. See if you can. Good, 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 good. All right. Now, I need you to cover up the one eye. All right, good. And then let me look at the other eye. All right, very good. How do you feel about that? Okay, so you still think you're seeing things? All right. I need you to hold still, and I'm going to see if I see anything in there. All right, good. How do you feel? Good. All right. See if you see anything now. Okay. Just a Just that a little bit. Oh my goodness. Yeah. Okay. Can you hold still? I just want to check your glands. Can you push your eyes shut? Like, I want to pull up. I want to pull down. Okay. Just like that. Pulling up. And pushing down. Okay. The next thing, puff your cheeks out. Okay. Feel your glands. Yeah. Okay. All right. Okay. I want to get out my otoscope and I want to look inside your eye, see if I see anything. Okay. Get in there. Yeah. Good. How do you feel? All right. Very good. All right. Now we'll check the other side. Don't worry. You're not going to get hurt. Just checking, Good. Okay. All right. Shut that back off. Now, following my pen again. Hang on a second. Got a little problem with my eye here. Allergies. Following my pen again, if you will. Let me know when. Okay. Again. Good. And this way. Good. Same thing with the other side. Look straight ahead. Good. All right. Now, this is very important. How many fingers am I holding up right now? Okay. And now, how many fingers am I holding up now? Very good. Sorry. All right. And if I do this, how many fingers am I holding up now? Okay. Good. And one more time. How many fingers am I holding up now? Good. Okay. Now let's just get in closer here a little bit. I want to do a little check here. Oops. Oh, that's a little close. I'll pull that in here so you don't fall down. There you go. And I'll check you again. All right. Good. How do you feel? Feeling all right? Good. All right. I'll check with the other side. Good. All right. Yeah. Oh, yeah. Yeah, it's not so bad, is it? I think, preliminarily speaking, I've seen this before where people think they see things, For instance, you're saying that this looks odd to you, this tool right here. But I think it's just all in your mind. And I think once we get you to really think about it, it'll go away, And the light you're seeing from it, it's just me manipulating the back. It's just a tool for looking in your eye. Yeah. So I hope that helps you think about what's going on right now. All right? Yeah. And see, we're just checking to see how your eyes react to the tool. It's no big deal. Yeah. And the rattling you hear, that's just the batteries rattling around inside it. Yeah, good. Okay, so I feel pretty good. We're going to check your reflexes now, if you don't mind. So, if you don't mind checking your reflexes, oh, don't worry. It's much more intimidating than it looks. Give me your arm. All right. And let me take the weight. Okay, thank you very much. Okay, just there. That feels good, doesn't it? Good. Good. Yeah, that felt good, didn't it? Yeah, I thought so. Now, let me check one more time. Ready? Let me take the weight. Thank you very much. Okay, get ready. There. Good reaction. How'd that feel? Good. I thought that felt good. I thought that felt right. I'm glad it did. Now, let me check your other arm. Okay, let me take the weight. Checking your reflex now. Ready? Oh, that was a nice loud slam. Okay, yeah. No. You reacted properly to it. Don't worry. Everything's fine. But let's do it one more time. Okay, now let me take the weight. Ready? All right. Good. All right, that was very good. How do you feel? Yeah, I know. Good. I don't want you to feel odd or strange about it. I know it can be that way sometimes, but I want you to be happy with the results. Yeah. Yeah. Don't worry. You're with among friends here. So, now it's time. We want to check your hearing. Can I check your hearing? Do I have your permission to check your hearing? Okay, I'm going to use this tool, and it's going to make a little bit of sound. I know, it's weird, isn't it? And let me know if you hear this sound in your ear. Do you hear that? Good. And we're going to do the same thing on this side. Do you hear it? Good. Now I want to do one more sound. Let me know if you hear this sound in your ear. Do you hear it? Good. And then a sound in this ear. Yeah. Good. Well, I think you're doing quite well. How do you feel? I keep asking how you feel because you look a little nauseous. Are you sure you're all right? I know allergies are bad this time of year. I'm having a tremendous amount of problems with my eye. But as you can see, it's just a little red. I take drops for it, which I already put in this morning. And I take a allergy pill. So, do you mind if I check you with the otoscope one more time? Okay. All right, good. Get in there and check. All right, I want to get in there and look really close. Okay, good. Good. Yeah. Good. All right, and then we're going to check with the other side. All right, dial it in and get in there and check. Good. Good. Just want to check really close. Yeah. Oh, yeah. Check in there really close. Yeah, you're doing great. All right. Good. Now, the next part of this cranial nerve exam is really simple. I just want to check your pulse. See how rapid it is? Do you mind? All right. Just breathe normal. Wow, your heart rate's really up. Just breathe normal. Breathe normal. I know. Don't get nervous. Nothing bad's going to happen. Yep. Just looking around. I think you're just a little nervous. Your blood pressure probably needs taken at this time. Do you mind if we take it? I'll have the nurse come in. Okay, well, we'll get that after we're done. I think you can wait till then. All right, now I need you to pay attention now. Do you hear that? Yeah. What's that sound like to you? I need you to take both your hands and put them above your head, like so. And I need you to focus on my hands. Focus on my hands. All right. Let me know when you see them leaving the screen. Good. Let me know when you see them coming back. Okay, good. Good. Good, good, good. Good, good, good. Now let me know when you see them leave the screen again. Oh, yeah. Yeah. You're all right. No. You're fine. You're fine. You're fine. There's nothing wrong. Okay. Now, all right, we're going to check you for colors. All right. I need you to tell me what color is at the top of this light. What do you see right here? Good. Red. That is correct. Now, tell me which color do you see here? Good. Yellow. That is correct. And I know it's ridiculous, but we have to check. What color do you see here? Green. Correct. Now, one more time, except this time I want you to cover this eye. What do you see when I hold it up? What color is this? Good. Red. Very good. That is correct. Now when I hold it up again, what color do you see now? Right here. Yellow. That's good. Now keep that eye covered. Keep that eye covered. All right. Now once more, when I hold it up, which do you see now? At this one right here. That's right. Green. Green is exactly the color you should see. I'm so glad you see green. Very good. I know it's a little strange. I know that you're not feeling yourself, but I think you're doing quite well. If you wouldn't mind, would you cover up the other eye? Thank you. I have a funny story about the covering up the eye thing. Maybe I'll tell you after we're done. Do you want to hear it? It's a true story. Okay. All right. Well, first off, what do you see when I point to here? Red. Good, good, good. I know it's redundant, a pain in the butt, but you've got to try it. What do you see when you look here? Yellow. That's correct. And what do you see when you look here? Green. Good. Now with both eyes uncovered, can you tell me what color you see flashing? All right. Good. Good. Again? Yeah. Good. 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 Unbelievable. You're doing so well. Okay. Now I'm going to tell you a true story. And this was relayed to me by my father years ago before I heard the story about the boxer, the boxing legend, Philadelphia's very own champion, Joe Frazier. Most people don't know this. Joe Frazier was almost legally blind in one eye. So was my father. But he still got into the military, and Joe Frazier still fought professionally in fights. Now, the way they did it was they would be asked at their eye test, okay, cover up your one eye, read the chart. Okay? They would read the chart, pass the test. Okay, now cover up your other eye. Okay? And they would read the chart and pass the test. Did you see what I did? Okay, read the chart. Okay? Now, use your other eye. And by doing that with the other arm, it fooled the eye examiner. I know it doesn't make sense, but it worked. And Joe Frazier fought Muhammad Ali with one eye tied behind his back, literally. It's not very funny, but true story. Thought you might like that story. Okay, now, I want you to tell me when I hold up something, how many do you see? Do you see 1, 2, 3, or 4 cards? Okay, good. All right. Now, how many do you see now? When I hold up the cards, how many do you see? 1, 2, 3, or 4? Okay, good. And now, how many cards do you see if I hold them up? 1, 2, 3, or 4? Good. Good, good, good. All right, now I'm going to do it one more time. How many things do you see if I hold them up? Okay. 1, 2, 3, or 4? Good. Very good. I'm very proud of you. You're doing so well. Now, I need you to focus on my voice. What are you thinking about right now? What thoughts are running through your mind right now? Good. You see what? So if I hold up my otoscope, you see this siren head? This doesn't look like siren head. Oh, this one. This looks like siren head. You think so? What do you call this one then? That's very interesting. Let me check your eyes again. I think something's wrong with you. And I want to make sure. All right, just let me look. Boy, that's something to worry about. I don't know. Let me check the other side. Do you feel nauseous? Do you feel sick to your stomach? No? Okay. I really don't know what to say at this point. I've given you a complete cranial nerve exam. I feel very good about it. I think you're doing well. I'm a little perturbed by the fact that you think you see monsters. What do you see when I hold this up? Okay. All right. What do you see when I hold this up? Oh, really? Like a spider almost? How does that work? Is it like a meme or something, or a Reddit post or something? I don't know. Okay. Very odd. So that's what you see, huh? Okay. So that being said, what do you see when I hold this up? All right. All right. So you think you see Siren Head. Okay. And he's reaching out for you like he's going to get you. All right. Okay. Like blah, blah. Okay. All right. I wasn't trying to frighten you. So you feel like he's just going to like strangle you or something? Or touch you or grab you or something? Or take you away? Or what? I'm not sure. Okay. So, all right. There is that. so when he gets closer, his hands are out. All right, did you feel this before, or is this just something new? Okay, you didn't feel this before. You're feeling it now, right? Okay, all right, all right, okay, all right. We'll take it away, all right? What do you see when I hold this up then? Still siren head, huh? All right, can you hold still a second? Let me just try something here. Okay, just kind of lean forward a little bit and... All right. Yeah, I know. Did that help at all? No. Okay, let's... It hurt. Okay. Now, what do you see when I hold it up this now? Okay, okay. All right, still see siren head? All right. No, he's not coming to get you. He's not, I promise, he's not going to... It might look like it, but he's not going to strangle you or take you away or anything. All right, okay, so lean forward one more time. Let's try this again. All right, hold still. Ready? So, I want to get the right lobe that time. Okay. All right, now let that settle in for a second. I'm kind of, might sound a little weird, but I was kind of, the whole hitting you in the head thing. I was kind of like thinking of my dear friend, and he's a great ASMR artist, Whisper Soft, and I was thinking, what would he do, like right now? And I was thinking, whack him in that brain, whack him, straighten him out. So, maybe that'll help. I don't know. Silly. I know, but, All right, so what do you see when I hold this up? Oh, okay, so he's reaching for you like Gundam style? Like, kind of like that? Yeah, Gundam style. So it's kind of like neurotic looking. Yeah. Like he's... Oh, that's disgusting. Well, I think it's late enough in the video we can get away with it. Yeah. All right. Is that frightening you? Okay, I can take it down if you don't like it. You like the sound? Okay. Well, you never know what people like anymore. It's kind of weird, isn't it? It looks like he ran out of energy there. My otoscope. So, but you do see the colors when I hold this one up, right? All right, good. So that one there, yeah, it's really scary, isn't it? Like, well, we don't want you to be frightened, okay? So if you are, I'm sorry. We'll stop doing that. All right, and maybe we'll have him be a little more friendly. Kind of like, kind of like, but I was surprised you see what I see, which is basically a lighted up, marker that I can use to tell what color, you're seeing, So that's kind of odd if you think about it from my point of view. We're both seeing not the same thing, but it's very similar. It looks like a stoplight. That's what it's supposed to look like, but not a monster with arms like reaching out, trying to bite you and stuff like that. But I don't know where the mouth is on the thing. So now that doesn't have a mouth, but this one does have a mouth. This one, no, just an eyeball. This one has a mouth right here. No? Okay. This one has a mouth on it. Oh, okay, this one does, and teeth. Okay. All right, good. Well, that makes a lot of sense. I heard about this siren head guy before with a friend of mine, Alternate Aurora, and I'm wondering if that's what you're seeing right now. Like, maybe you've been reading too many Reddits and you're just getting like thoughts stuck in your head, Yeah. Well, I think we can definitely rule out psychosis at this point. I think you're just seeing things, I think you weren't hit in the head hard enough and we'll have to work on that, okay? All right. Kind of like a whole Gilligan's Island thing where, like, you know, you get hit on the head and you have amnesia and then it wears off. So I think that's what you're having right now. And hopefully that will cure itself with some good sleep, you know? Or we could try hitting you in the head again if you want me to. No? Okay. Well, it's the thought that counts. It really is in these matters. But I'm glad you feel better. I'm glad you want to go home. That's a good sign, isn't it? I mean, before you wanted to check in and, you know, get yourself sectioned, you know, in the mental hospital. But now you're just wanting to go home. I think that's a good sign, isn't it? Yeah. Good. Well, I'm glad. I'm glad you feel better. Well, I'll tell you what. I'm always here to help you. I know things are a little strange right now, but I am always here to help you. I am. That's why I, Dr. Andrew Michaels, never give up on you. Never give up. And until I see you again, you know, go home, get some rest. Let me know how it's going. And we'll see you soon, okay? All right, until then, have a most blessed day. All right? All right, bye-bye. Goodbye.